We pass on to another part of the lesson, which is cancer. Now, I'm sure all of you have heard about cancer, the different types of cancer. You may have heard about carcinoma, which is the cancer caused in organs developing from the epithelial tissues. Or you may have heard about sarcoma, which is diseases caused or cancer caused in organs developing from the mesodermal layer, like the bone cancer, the cartilage cancer, etc. The melanoma, which is the cancer of the skin, leukemia, cancer of the blood, myeloma, cancer of the myelin sheath. So there are different kinds of cancer. Now, before we learn more about cancer, let us discuss about the differences between a normal cell and a cancerous cell. What is the difference between these two categories? In a normal cell, there's a definite cell division. It is in a very regulated manner. You may have studied the cell cycle, and that cell cycle happens in a very regulated manner. Soon after the cell division, the cells are found to differentiate. Differentiation is a very characteristic feature of a normal cell. And these differentiated cells, they adhere to each other. The moment they start growing, they adhere to each other. And uh, each cell has a definite lifespan. After the lifespan, the cell undergoes the process of cell death known as apoptosis. So there is a lifespan and the cell dies. Another very important feature of a normal cell is contact inhibition. Now, what is contact inhibition? Contact inhibition is, I told you that when a cell grows and it comes in contact with a neighboring cell, it immediately stops growing. That process is known as contact inhibition. It does not grow into the neighboring cell, but just remains adhering to it and shows contact inhibition. It does not grow into the other cell. And typically speaking, normal cells have characteristic rounded nucleus, and this is a characteristic feature when we look into the slides of a normal cell and a cancerous cells. And normal cells do not show tumor formation. So these are the typical characters of a normal cell. Now, how do we differentiate a normal cell from a cancerous cell? A cancerous cell does not show regulated cell division. It is an uncontrolled cell division. There is no regulated kind of cell division, but it is totally uncontrolled. And once the cells have divided, they still remain undifferentiated. You don't find differentiation happening in the cells. They remain undifferentiated. And they do not show contact inhibition. They do not exhibit contact inhibition, but they grow into each other and into the neighboring healthy cells. So contact inhibition is totally lacking in the cancerous cells. Another one is cell death is inhibited. We saw in the case of a normal cell that there is a definite lifespan following which the cell dies. But in cancerous cells, cells don't die. The cell death is inhibited. Another anatomical feature is the presence of irregular nucleus. The nucleus in the case of cancerous cell is irregular, not rounded, but irregular nucleus. And these cells, due to uncontrolled cell division, we always find that there is tumor formation as far as cancerous cells are concerned. So this is the difference between a normal cell as well as a cancerous cell. We saw that cancerous cells lead to formation of tumors. Now there are two different kinds of tumors. One is known as a benign tumor. We have learned about this term benign. Benign means that which is not fatal. Now a benign tumor is a tumor which is localized at a particular region, and it is normally enclosed by connective tissue. So this is not very harmful. Being localized at a particular region, benign tumors are less harmful than the next category, which are known as the malignant tumors. Malignant tumors contain a malignant form of cells called as malignant neoplastic cells. So these tumors are made of malignant neoplastic cells and they are not confined to a particular location. They are not covered by connective tissue. The tumor is not covered by connective tissues, or they are neither are they restricted to a particular location. Now what happens is these malignant neoplasmic cells can proliferate very rapidly and they can invade the normal cells, thus depriving the normal cells of vital nourishment. Then what happens is these malignant neoplastic cells, they can detach themselves from the original tumors, detach themselves, and through the bloodstream they can reach a distant site, resulting in the formation of fresh tumors. For example, suppose there is a tumorous neoplastic cells in the stomach. From the stomach through the bloodstream, it can reach the liver, and on reaching the liver, it can start forming secondary tumors. So from a primary tumor which was there in the stomach, it is now reaching a liver cell forming secondary tumors. From there it can reach another site forming tertiary tumors. So this is a very dangerous situation, and this process by which a neoplastic cell detaches itself from a primary tumor, passes through the bloodstream, reaching another fresh site. This process is known as metastasis. So metastasis is normally exhibited by malignant neoplastic cells, and it is a very feared property of the malignant tumor. Let us now discuss about the different causes for cancer. The cancer causing agents are known as carcinogens. They are collectively called as carcinogens, and carcinogens or cancer can be caused by several reasons. Let us discuss what are the reasons. The first reason is the physical reason. Now, for example, suppose there is a broken tooth in the mouth, and this jagged portion of the tooth, the broken tooth with sharp edges, constantly aberrates the cheek epithelium. That may be a reason, combined with probably suppose there is consumption of tobacco. Probably this particular reason may cause cancer of the mouth. The second reason is constant friction. If there is constant friction to a body part, then that can, for example, that may cause skin cancer in some individuals. Cases are reported where if the sari is worn very tightly, as in the case of Maharashtrian women who wear the sari, drape the sari in such a way that passes between the legs. Cases are reported that such kind of constant friction may cause. Okay, there are possibilities for cancer. Use of kangris. What are kangris? Kangri is a small earthen pot where hot coal is placed, and this hot pot is placed close to the abdomen in the case of people who live in very cold countries of India. So this kangri, and then this hot pot is wound around the body using a shawl so that the heat permeates into the body. Now this thermal heat and the friction is a physical property which may induce some kind of skin cancer. So this is the physical factors leading to cancer. The second one is radiations. Radiations, both the ionizing radiations like X-rays and gamma rays, as well as the non-ionizing radiations like the ultraviolet radiations, can cause DNA transformation, leading to diseases like leukemia or blood cancer, and also skin cancer. So radiation is one cause for cancer. The third cause is the biological cause. There has been certain viruses called as cancer causing viruses, and these cancer causing viruses have certain genes called as a viral oncogenes, and these viral oncogenes can cause cancer in human beings. Example, HPV or human papilloma virus, which causes cancer of the cervix. The next biological factor is all the normal cells contain cellular oncogenes or CONC or proto-oncogenes. Now all of us have the normal cells containing these particular genes. But these genes in some people may be triggered, and when they are triggered by certain other factors, they can be converted into the dangerous form, and such cells may start dividing uncontrollably, and that happens only when it is triggered. So biologically, these are the two reasons. Then comes the chemical carcinogens. Chemical carcinogens are certain chemicals. There are so many different types of chemicals that can lead to cancer. One typical example is the cigarette smoke. Cigarette smoke contains a chemical component called as nitrosodimethyl. This nitrosodimethyl may cause cancer of the lungs. Soot. Soot is a chemical which is a chemical carcinogen which can again cause cancer of the respiratory system. Aflatoxin is another carcinogen which may lead to cancer of the liver. Asbestos. Asbestos fiber can cause cancer of the lungs. Mustard gas is also a chemical carcinogen leading to cancer. So all these are agents called as carcinogens. Let us now discuss how is it possible to detect cancer and to diagnose cancer detection and diagnosis. There are various methods by which cancer can be detected and diagnosed. The first method is known as biopsy. I'm sure you have heard about biopsy. Biopsy and histopathological studies. Now, what exactly is biopsy? Whenever a doctor carries out a surgery suspecting cancer in a particular organ, a small piece of the suspected tissue is um, cut into very thin pieces, and then it is studied for its pathology, histopathology, meaning tissue. The tissue is then studied for pathological evidences. So biopsy followed by histopathological studies is one way of detecting cancer. Similarly, study of blood and the blood marrow test. When the blood is subjected under histopathological test, it is stained by a pathologist and it is studied for pathological test. It is possible for us to see whether there is an increase in the cell count or whether there is any change in the appearance of the nucleus or whether there is any change in the growth of the cell. All that can be diagnostic for us to detect cancer, for a doctor to detect cancer. The third detection methodology is through radiography, and radiography in turn can be using X-rays. X-ray can always detect the presence of cancer, or a CT scan. What is a CT scan? Computed tomography scanning. This computed tomography scanning gives the radiographer a 3D image of the internal organ, and that in turn is very useful to find out whether there is cancer. Similarly, MRI scanning, the full form of MRI is magnetic resonance imaging, and in this type of scanning, strong magnetic field and non-ionizing radiations are used accurately to detect pathological as well as physiological changes in a living tissue. It is not needed that we have to extract out the tissue as in the case of biopsy, but in a living tissue, it is possible for the radiographer to see whether there is any pathological means diseased condition, or any physiological functional changes in a living tissue. So all this comes under radiography. The next one is monoclonal antibodies. Monoclonal antibodies are used against certain specific cancer specific antigens, and this can also help us in detecting cancer. Now, techniques of molecular biology is used to detect genes, especially in individuals with increased susceptibility. There may be some individuals due to genetic reasons, they have increased susceptibility to cancer. And such individuals are asked to avoid exposure to certain carcinogens, like in the case of tobacco smoke, in the case of lung cancer. So such people should not be exposed to tobacco smoke, and that will help in reducing the incidence of cancer. Let us see how it is possible to treat cancer. Earlier, cancer was a very dreaded disease, but nowadays there are various protocols to treat cancer. The first protocol is surgery. If a tumor is detected, it is possible for a surgeon to remove the cancer through surgery. The second one is through focused radiation. So radiation involves whenever a cancerous tumor is detected, it is possible through radiotherapy to irradiate lethally, taking care of the normal tissues that surround the tumor mass. It is possible for us to destroy the tumor mass. The third one is chemotherapy. In chemotherapy, several therapeutic drugs are used, and these drugs can destroy a cancerous cell without having much effect on a normal cell. But then, majority of such drugs have a lot of side effects. The common side effects of chemotherapeutic drugs are anemia, hair loss, as well as severe fatigue. So these are normally the common side effects of chemotherapy. Next one is in immunotherapy. It is seen that normally tumor cells avoid detection and destruction by our immune system. So, patients are given substances known as biological response modifiers. Okay, such patients are given certain modifiers like alpha or A tilde interferons. And what do these interferons do? These interferons can activate the patient's immune system, and this in turn helps to destroy the tumor by the immune system. So it's a very effective method, this immunotherapy. But nowadays it is seen that a combination of all these therapies, either it could be surgery along with radiation, or it could be radiation as well as radiotherapy and chemotherapy together. All these holistically are used to combat cancer in most of the patients.